So in this video, I just wanted to have a talk to you about our canine vaccinations. And if you recall, our puppy schedule for giving these vaccinations is a course of 3 vaccines, 4 weeks apart. So we give the 6 to 8 weeks for the first one, 10 to 12 weeks, and then 14 to 16 weeks of age is the puppy course. And then we give them an adult booster. And then after that, we give them, depending on what vaccine we use, we might give some vaccines every year and we might give some every 3 years. So firstly, what makes up our vaccine? Part of the canine vaccine is what we call the C3 component. So that contains 3 antigens, or it covers 3 diseases. It is also known as the DHP vaccine, and that can help you remember what it covers. So the C3 or the DHP vaccine covers distemper, hepatitis, and parvovirus. So that's our C3. From there, we can boost it to be a C5 vaccine, so we're adding 2 more components, and that is the kennel cough component, which these days we really should be calling canine cough, because if we use the term kennel cough, it gives owner the impression that they can only contract this disease if they're in kennels, and that's just not the case. So to make up a C5, we're including 2 components of canine cough, and those are Bordetella bronchoseptica, that is a bacteria, and also parainfluenza, which is a virus. So kennel cough has a bacterial and a viral component, and if we give all of that together, we give the C3 and the kennel cough, that makes up the C5 vaccine. The kennel cough vaccine is always given annually. Okay, it's one of those vaccines where the immunity that develops in response to the vaccine is not of a long duration. Okay, whereas the C3, as an adult, really should be given every 3 years. The kennel cough, the immunity just doesn't last as long. So that's a yearly vaccination. So regardless, we tend to see our canine patients in for vaccination once a year. It just depends on whether we're giving them the full C5, including the C3, or whether they're just in those intermediate years where they're just having the kennel cough vaccine. So we need to be aware and refer to our records as to what that animal is due for. Bear in mind that the kennel cough vaccine can also be given intranasally. So it can be given as a little liquid. We just draw it up and we use these little intranasal pipettes, if you like, and they just help us direct the liquid up the nostrils. Now, only 1 drop of liquid needs to touch the mucosa for it to be effective. So if they do snort a lot of that liquid out, it's okay. I tend to even just put some on a treat and they then get the vaccine into their mouth, which will also stimulate some immunity at the back of their throat. The beauty about giving an intranasal vaccine is it does not require a booster when they're a puppy. They don't need a second exposure. It also stimulates a quicker immune response. So if the dog is about to go into boarding kennels, this will work in about 5 days. They will have a response, 5 to 7 days, rather than the 10 to 14 days that the injection requires. So quicker immunity, no booster, and it stimulates that local immunity at the lining of the mucosa of their nose. Okay, so lots of benefits actually, if you can, to give an intranasal vaccine. There are a few other vaccines that we might give to dogs, much less commonly. One is a vaccine against coronavirus. Now, it's not the coronavirus that we know. It is a virus that is very similar to parvovirus. It causes very similar clinical signs, such as the bloody diarrhea and vomiting. And the other one that you may find some clinics give is a vaccine against leptospirosis, okay? And that is a zoonotic disease, so that's something we need to consider, and that can be contracted through rodents, and also if they happen to be farm dogs and are being exposed to the urine of cows and things like that. When we make up our vaccines, so if we go back to our C5 vaccine, I just want to mention that drawing those up and preparing them, they do come in different configurations. So some will come with a separate C3, and then you add your kennel cough to this. You might be in a clinic where you actually have a C4 in the bottle, and you're just adding 1 component of the kennel cough. So you, again, just become familiar with what your clinic stocks, how to administer just a C3, and how to administer that full C5.